Hi, everyone. Thank you for being here. My name is Chris Galloway. I'm the Executive Director at Friends of Medicare. We're hosting this virtual version of our town hall this evening. Thank you so much for joining us on what's turning into a very sunny Sunday out there, and you're still taking the time to join us online. So thank you for that. And just before we dive in, I want to acknowledge where I am here on Treaty 6, and I know Paul is on Treaty 7, and many of you are from different places across the province on treaty territory, and how important it is to remember whose land we're on, those treaty relationships that include things like the medicine chest clause, that important commitment to health and healthcare, and also with what's happening in Alberta, remember that we have a duty and a relationship and responsibilities to First Nations in these territories. And when the chiefs of those nations are passing motions of unanimous concern and non-confidence in our provincial government, I think we all need to listen to what we're hearing. So as we're meeting today, I would ask everyone to think of how we can show our solidarity and our support for the First Nations on these lands as they're pushing our provincial government. So I will leave it with that and move into why we're here today. We're here to do a virtual version of our town hall tour. We've had 19 town halls across the province. And this is our 20th virtual version by popular demand. There were folks saying, could you do a version online? I wasn't able to make it in my community, or I live somewhere more remote. So we're glad to see so many people flooding in to the attendee list as it keeps growing and growing while I'm talking. So this is one version of that. It'll look a bit different than if you were at one of the in-person ones. Obviously, an in-person conversation and dynamic is a bit different. But what will happen is we will have Dr. Paul Parks do his presentation. I'll come back on and we will give a little update and open it up to Q&A. And there's a question and answer box feature at the bottom that you'll see. It says Q&A. You can type questions in there. We will answer them in there and verbally as we go. So please use that feature. If you have a question throughout, we will deal with those at the end. So that will be the program. And I'm just really happy to have Paul here with us again today to do this for the 20th time. He's joining us as a well-known emergency room doctor for Medicine Hat, a former president of the AMA, a well-known health advocate, but he's also joining us as a volunteer who's doing this, between shifts, joining us on the road. He's not here speaking on behalf of any organization or any role that he has. He's really donating his time as we try to fight back and protect public health care for all that basic idea that no matter who you are or where you live or how much money you have, you should have access to healthcare when and where you need it. So that's what we're all fighting for. We're in a really important moment here in Alberta right now. So this is a more important conversation than ever. But I will not digress and go on about that. You're all here because you care too. So I just want to turn it over to Paul to give his presentation, and then we'll get into the conversation part of the evening. So thank you so much for being here with us again for the 20th time to do this.
Awesome. Thanks, Chris there. Just make sure I get a thumbs up. You can hear me well. Good there. I'm glad that we could do this virtually. Lots of people asked for this virtually. It's obviously was designed to be more of a in-person, learn from the communities, figure out what their unique issues as going across the province, what each community is challenged with, what are some of the commonalities, what are different, hear the feedback and hear your inputs and concerns. But also I think that with travel and with not being able to get out to every small community that's being impacted, I think it's awesome to be able to do this virtually here. And I'm just noticing, I'm thankful for everybody that's here on a sunny day where we're finally having spring and there's no snow and the sun's creeping in and going to hit me right in the middle of this probably, but not much I can do about that. But I wanted to just say, I'll try to keep it brief and kind of just summarize what's been going on in healthcare in Alberta from my perspective and the lens so that people understand and we have a context about why we thought it was really important to have urgent conversation about healthcare, and is healthcare going in the right direction, and are the changes that are being done meeting the needs of Albertans, and what can we do about it if we don't think they are. And I just would say that I am an emerge physician still working on the front lines. I work again tomorrow. We squeeze this in between shifts. I'm back in all next week in Medicine Hat working, and so on an evening shift tomorrow even. So I see every day on the front lines what's happening in Medicine Hat. I've worked up in Edmonton, so big academic center. I've worked in the regional center in Medicine Hat, and I've traveled out and worked in a bunch of the smaller communities through stars and different things in my career, and so I've got a really good feel of what's going on in Alberta, and I have a lot of colleagues that have been, remain connected so we can see what's going on in Alberta. And then I also had the very lucky privilege of being the president of the Alberta Medical Association almost at the exact same time that this new government came in. In fact, I started my term a little bit early, just meeting with the government when Minister LaGrange and the Premier started their government. And so I would just say that, I think I was at the table working with them saying, please, steal my ideas, steal my colleagues' ideas. Let's work together. Let's try to make some big system changes and improvements for healthcare, because we are struggling. We're coming out of a major pandemic. We have a whole bunch of issues that are going to hit us, and we're in trouble, and we need to work together. And unfortunately, I think one of the things I've learned, and why I'm doing these talks, and why I really want to connect with as many Albertans to discuss about healthcare as we can right now, is that I've learned that no one person can change the momentum of the healthcare system, or no one person can force government to implement policies in certain ways. That it's going to take a lot of us. And so I think that a big part of this is just starting talking about what's happening on the front lines. What are we seeing in the big system? And then how can we all engage and work together to try to make the system better? And what one big piece of this that I always, I kind of hate to be the voice of negativity, where I keep, pointing out where the system is having difficulties. But in Emerge, we own the sins of the system. And what that means is we know that any part of the healthcare system that's not working appropriately, or you can't get access to your family doc, you end up in Emerge. You can't get post-operative care, you end up in the Emerge. You can't get imaging for acute illnesses, you end up in the Emerge. Everything that's not working in the healthcare system, you end up in the Emerge department. And so we see what's not working in the Emerge department. And so as a result, I think I have I and my colleagues in Emerge have a very good lens to be able to see what's happening. But because of that, we also see where it's broken. And I'd hate being the voice of always talking about, here's where the healthcare system isn't meeting the needs of Albertans. Here's where we need to do better. And so I should stay off right off the get-go. Like when you get into our system, you get some of the best healthcare in the world. And I believe that with my heart. I see it every day. I see, even in the last couple of shifts I've had in Emerge, with extremely sick patients, in a motor vehicle collision, thrown from the vehicle, and they get rushed into our hospital by a really quick ambulance response that brings them in to see my team, and we stabilize them, and we fix their broken bones and set everything and save their lives, and then get them off to Calgary for a trauma service, say, as an example, where they get on a fixed wing plane and within hours are in a major trauma center in Calgary. We see how the system works and saves lives amazingly when you can get into it. I see it every day, and I know we can do better. And that's why I think we need to start having conversations like we are having here tonight. And the reason that I preface that is that I'm going to give some real examples of what's been happening in our healthcare system, because what I've learned is there's endless stats. There's just endless stats. In fact, I don't even think the government fully understands the stats that are provided to them around, the alternative level of care patients. So how many patients are stranded in our hospitals because they can't get out into long-term care or continuing care, or how many EIPs, so emerge inpatients, are stranded in an emerge department with pneumonias or broken hips or cancer, illnesses that can't get up into the hospital because there's no space for them. All these endless stats of how, what does it mean if a hospital capacity is at 120% capacity? They're just random numbers, and I don't think people understand the human impact and that there's a human being at the end of every one of those stats. So have to lead off a little bit with some negativity of real examples, like the example of Mr. Sri Kumar, who was a gentleman in his 40s that I think everybody will have heard of, that presented to one of our major emerge departments and waited, over 8 hours with severe 10 out of 10 chest pain. And unfortunately, and very tragically, by the time he got into a care space, he immediately had a life-threatening event and died. And we have to be understand that as soon as we learned about that, and I learned about that, I went to all my colleagues across the province and said, we need to actually collect some extra cases that are happening right now and send them to the government so they understand that Mr. Sri Kumar is not just a 1 in a million bad outcome, that isn't happening very frequently. And we sent to the government a whole bunch of cases and examples of actual other people that we've seen have bad events, like someone in their 50s with an infection and a high fever and delirious, a bit confused and dehydrated, who waited hours and hours in one of our other emerge departments and ended up leaving without being seen, and then hours later was sicker and sicker. By the time that the ambulance went back to get them and brought them into their hospital, they had severe spread infection where they passed away and died. We gave a number of cases, like cases too of really near misses, but people with, a bowel obstruction, so a blockage in their bowel, twisting, sitting in our waiting room for hours and hours in severe pain, to where unfortunately that twisting caused a hole and a rupture and a tear in the bowel, and then infection spread through their body, and they passed away. And we know that if we could get in there and intervene and see those people in a timely fashion, we could save their lives, and we absolutely could, prevent these untimely deaths or prevent this suffering. And really sadly, it's not just in the big centers now. We have cases, real cases in the last couple of months of someone in their 20s with severe asthma who, racing to a community small emerge hospital in a place, the size of, say, Edson. I'm not saying it was Edson, but the size of Edson, and racing to their hospital emerge department to find out it's closed. And they're in there in respiratory, distress and not breathing well. And they call EMS and they find out that there's no ambulances in the area available to respond for them, because they're all transporting patients hundreds of kilometers away to the next emergency departments. And that patient ended up having, some severe lifelong damage to the brain because of not enough oxygen from their severe asthma. But they didn't even know that their emerge department was closed. And so in the rural communities, more and more impacts and services are being uh, impacted, where people don't even know that the services aren't even available there when they or their loved ones need it. And so we're just seeing that trickle go more and more and more, and more communities. It's one of these things that I say all the time too, is that people, you don't know what you've got until it's gone. And now more and more, as I've traveled across this province and talking to Albertans, they're starting to see that when they are going to try to get access to a family doc, they've moved away and they don't have a family doc anymore, or their emerge departments are closed, or they go into major, larger centers in the city and go into emerge departments and have to wait 6, 7, 8 months to see a cancer specialist when they have a new diagnosis of a cancer. And they don't understand what our system is what's happening to it, until they try to access it, until they try to need it, in need of it. And then even worse is what happens is, once communities start losing some of those services, or as things get worse and worse, we end up, it becomes almost impossible, or a gargantuan effort to try to replace those services. So I really feel like we have to start talking about this more, and put a human face to what's happening to the access block, and what's happening to our healthcare system. And so, but the other piece that I really, really want to talk about, and really reinforce across the province is this isn't about ideology. This isn't about, I don't really care if you vote left, right, you've always voted for this party or not. It's not about ideology. It's about, let's talk about what's happening in our healthcare system. What is happening in the last 3 years, for example? Healthcare is struggling and challenged across the province, across the world, for healthcare workforce, for example. There's struggles everywhere, but what's unique to Alberta, and let's not talk about ideology, but let's talk about facts. Let's talk about what's really happening and what's changed in Alberta. And so one of the things that the government has openly campaigned about, and the premier's been very led with this and vocal, was one of the things that's very unique in Alberta that's challenging us, is that the premier decided to blow up AHS and destroy a big integrated provincial healthcare system that was in many ways the envy of many, many health systems across the world. Was it perfect? No, I would never ever say that AHS was perfect. There were things like local control and decision making that we could have improved on, but would any of the experts and frontline people say totally blow it up and break it up into many pieces? No, but the premier did this, and so they did refocusing. They called it, and that euphemism really does want me to wants to make me pull my hair out because our system has never been less focused. It's never been more chaotic. It's never been more disintegrated. Because what did the government do? In simple terms, they took a big integrated system and broke it up into many parts. And they created primary care Alberta. They created assisted living Alberta. They created recovery Alberta, and then acute care Alberta. Four big silos. But they also then now have four ministers of health instead of one, and they have each of those ministers have CEOs and have a huge bureaucracy underneath them in these new organizations. And then on top of it, though, they forgot there's probably 10 other things. They forgot about cancer care. They forgot about public health. Where would it fit in? They forgot about EMS. They forgot about so many pieces that are integral to the system. In fact, they spent 2 years chaotically breaking everything up, and then just recently decided to create this new integrated, I don't even remember the names of it all now. It's so confusing, but basically a fifth column that's going to kind of do integrated services for all of these, because they realized 2 years later they didn't have anybody doing some of the commonalities. It was so chaotic. So this refocusing got to the point where, what does that mean in real terms? Well, it means that basically I have nurses come up to me now regularly telling me that things like they may be a psychiatric nurse, for example, that works in sometimes in the community and sometimes in a hospital, and they'll be like, Paul, I don't even know who I work for now. Am I in Recovery Alberta and mental health, or am I in the acute care organization? Who do I report to? Who do I talk to if things are broken or not working? How do I report? What's the accountability structure? And you can multiply that by 1,000 now. Every single little group doesn't know what's going on and doesn't know what's happening. And so it's really, really critical for us to think about that this refocusing is very unique. It's not happening across the rest of the country. In fact, most of the other provinces are starting to integrate their services a bit more and connect them more. We've blown ours up and totally disintegrated it. So this isn't about, again, ideology, and this is about what's really, really happening in Alberta. So they have totally refocused, made it very, very chaotic. And what does that? What's just one example in all of our communities across Alberta that refocusing has made really difficult? Well, one would be that alternative level of care patients that I mentioned. So these are patients that maybe they're your senior frail a parent who had a fall and were barely managing at home, have other health issues, weren't doing the stairs very well, and have a fall and break their hip. Get a surgical fix of their hip, take a bit of time to recover in the hospital, but now they're debilitated enough that they can't go back home safely, and they need some assisted living or long-term care, or even some home care for a while till they can get placed in there. Well, what happens is those services don't exist. So right now across Alberta, 30%, upwards of 31 in 3 of every one of our hospital beds across this province are occupied by what have been designated as alternative level of care. So these are stranded people in the hospital whose acute care is all done, and they are stuck in hospital because they can't safely go out into the community or back to their homes without some resources being in place for them. 1/3 of our capacity falls under the control of assisted living Alberta now. So Minister Nixon and his bureaucracy have lots of the solutions and resources and ability to kind of address what's happening with 1/3 of the capacity in our acute care Alberta with a different minister, Minister Jones. towns and a different team and a different focus, and they're not coordinating together, and there's nobody above them saying, hey, this is mandatory prioritization, this is what we should do, this is how we're going to function. And so why that matters to every Albertan that's listening here is that regardless of where you live in Alberta, your loved one may be stranded in a hospital, not getting out to the resources they need. But then it also means that you might not be able to get safe and timely emerge care in the emerge, because those patients are stranded in the hospital. There's no beds for the new patients. So new patients that are really sick get stranded in the emerge department. They become called an EIP, so an emerge inpatient. So they might have a pneumonia, cancer, surgical conditions, strokes, heart attacks, anything you can think of. And they'll spend days and days in our emergency department so that we have no beds to see the new sick person coming into our emergency department. So it means that they've broken this up, and the solutions are totally, nobody's accountable, nobody is connected, and it'll impact you and your loved ones in your small community, or if you have to be transferred into a big tertiary hospital in Edmonton, say, for example, you might not be able to get sent in there because there's no beds. So this disintegrated, blow up, endless chaos of that many years of refocusing, of over 2.5 years of refocusing without any change management, has put us into full blown chaos. And then what else has the government done in the last 3 years? In addition to adding this really chaotic disintegration, they have decided that privatization is going to be the panacea and the solution and the savior to all of our healthcare woes. And they're selling to everybody in Alberta that privatizing and charging you out of pocket, or charging rich people who can get front of the line access, they have sold to Albertans that will increase capacity. And what I want to tell you right now is, it doesn't matter how many big buildings you build and how many machines you buy that go ping and do all these fancy things. If you don't have human beings to deliver the care, then that's going to always be our bottleneck and our rate limiting step. And right now, currently in Alberta, our healthcare workforce is so challenged and so stressed that we don't have enough human resources to be able to even, staff in certain areas our acute care hospitals and our ORs and our, after hours care, to the point where real examples now are that we don't have, ultrasound techs to do ultrasounds after hours in the majority of our hospitals. But what's going to happen when the government decides to privatize diagnostic imaging and allow private clinics to give anybody and everybody, whoever they want, an ultrasound? Those ultrasound techs are all going to move to the community. And I want to be really, really clear that the government is setting this up in a scenario where I don't blame any of my colleagues for making that choice. I don't blame colleagues for saying, hey, well, what would you do? Just everybody think about this. What would you do if you had the choice of, you could work 9 to 5, Monday to Friday, in a nice private clinic that only does the easiest cases, that that you never have to be on call, you never have to go in the hospital at 2 a.m. on a Saturday night for a multi-casualty motor vehicle collision that's chaos. You might even make more money in that stream. That's just as an ultrasound technologist, as one example. Think of all of our workforce if they're given a choice of that versus working in our really overwhelmed, overstressed, chaotic hospitals that keep losing more and more staff. I don't blame colleagues for making that decision. So right now, currently in Alberta, we've been doing that with their private chartered surgical facilities. We have, and all a chartered surgical facility is a private standalone facility that does surgeries, and they can only do the lower acuity type surgeries. So for now, they're doing a lot of it is eyeball surgery, so eye surgery, and then things like shoulders, hips, and orthopedic type surgeries, knees, but what I would want everybody on here to know, and this is just factual, if it's something that can kill you, it can't be done in a chartered surgical facility. If it's a major cancer surgery, if it's a transplant, if it's a motor vehicle crash and trauma, if it's really serious where you'll need a hospital bed for a long time after, none of those things can be done in a chartered surgical facility. But right now, because the government is doubling down and doing more and more funding to these chartered surgical facilities, we no longer have enough anesthesiologists and OR nurses to maintain our hospitals right now. Every single hospital across this province, our major ones, have empty ORs sitting there 24/7 empty. I'm not talking they're just empty after midnight, like completely empty all the time. As an example, Medicine Hat, Lethbridge, I'm down in the South Zone. They have a couple empty ORs, and the government wants to build CSFs and fund CSFs, these chartered surgical facilities, to do the easy cases where we're telling them we might not have enough anesthesiologists to do the cancer surgeries, to do the appendicitis, to do a gallbladder surgery, to do hip fractures. Right now in Alberta, it used to be very, very like common that if you fell down and broke your hip, we would fix your hip within about 36 hours. Now there are people waiting in severe pain, can't move, can't walk for 7, 8, 9 days with broken hips in hospitals because there's no teams to be able to do those care in our major hospitals even. And the queue of the sickest just keep bumping them because we don't have the resources. And those people, I've even had a colleague, an orthopedic surgeon colleague of me tell me that, Paul, I had someone sitting in the hospital with a broken hip for 7 days who wanted to sign out AMA to try to go to another hospital, thinking that they would try. AMA means against medical advice, trying to leave that hospital to go somewhere else because they were sick of waiting in pain. Because they thought they might get seen faster. That's what's happening. So again, I'm not talking ideology. I'm talking about currently right now, we have a government that's disintegrated everything, and we now are adding and doubling down this dream that privatization is going to fix everything and it's going to make more capacity when we have examples that it's actually going to make things worse. And so I have a couple more pieces that I just want to add to this before we open up to the questions and answers. And it's very odd in the virtual way here in that I can't really read any interactions and I'm not paying attention to the question and answers. So I just kind of want to make people aware that we will get to the questions, but I'm not looking at them. So it'd be a bit too distracting. So, but while I kind of sum up on a couple other pieces here, one thing that I want to just highlight about this privatization now. So the government now is not only trying to deliver more and more care out in the private facility, whether it's public paid by the public person, the government, or it's private paid out of your pocket now. Now they want to add dual billing. They want to add you'd be able to pay for any diagnostic tests and do any kind of tests you want, whether it's indicated or not. You can pay out of pocket. They might reimburse you if you find something that's important, but they don't have a clue what that would look like. They don't have a clue of the guardrails. But what I want to reinforce for you again is if it will kill you, or if it's really life-threatening or very serious, it can't be helped in these kinds of facilities. So we still always need to maintain our acute care hospitals and our staff and our ability to run our hospitals. And so just I'll leave it on a point of for everybody listening here, if you are lucky enough to be sitting in maybe you're a very successful business person in a small community and you have $50 million in the bank and you got tons and tons of money and you could buy as much private services as you want, it won't save you. It won't help you one iota if you're having your heart attack, if you're having a stroke, if you have a big, car accident, and you need to get emergency or hospital care. You may be another tragic case like Mr. Sri Kumar, even though the government's selling you that if you're rich, you can get front of the line pass and you can buy to pay. And the other thing that you can pay to get prioritized care. But the one thing I'll say too, the reason that I'm talking and having these conversations is that I'm a emergency physician, and I believe in my heart that that's not how we think our healthcare system should work, that it shouldn't be based on your ability to pay. It should be fully based on your need and prioritized by how desperately do you need, how serious is it, how life-threatening, what are the conditions. That should just dictate who gets in and who gets seen and how our system works for us, not just somebody that can jump to the front of the queue because they have resources. And so they're refocusing, breaking things up. They are adding this privatized dream that everything's going to get better if they create this whole stream on the side of privatized care that will take all of our healthcare workforce or a lot of it over there, without the magical ability to clone human beings, and already not being able to staff our empty ORs, or get our DI technologists, have enough of them in our hospitals. And then on top of it, they just have moved to this. They are not listening to experts anymore. They're not listening to frontline expertise now. In fact, if you look, Bill 29 came out. They've got this, Montreal Economics Institute, so a right-wing think tank is advising them from across the country on what we should be doing. They're not listening to anybody on the front line with experience. And I'm not talking just me. I mean, my anesthesiology colleagues, my cancer care colleagues, my family medicine specialty colleagues. They're not listening to any of the frontline experts. But I just want this to sink in. They're spending over $1 million a day on paying consultants that are not in frontline, that are, they're these shadow bureaucrats, consultants, $1 million a day to, that if since this government's been in, the number will be over 700 million, maybe a billion. We can't even find out the number, how much they're spending. But why you should be outraged by that, and why every Albertan should be outraged by that, is that $1 million a day to consultants that are not delivering care, and that are doing, in theory, this should help and that should help, and are these shadow bureaucrats from a government that's the biggest government in Alberta's history, that's going as much bureaucracy. It's made our healthcare bureaucracy go from a pretty lean, big, integrated to 5-6 times more bureaucratic, and now they're adding consultant layers to it. But $1 million a day, that's money that's not spent on healthcare. That's money on why we had crazy things like our government was going to cut popsicles for children who are getting chemotherapy for cancer, and trying to save money off of things like comfort and care on the front lines, because they're spending so much money on consultants. And then the last piece, again, that's in there and that everybody should be thinking about and know about, is corrupt care. And here's where I would normally poll people and ask how many people have heard about corrupt care. I think more and more are slowly becoming aware of it, but I think it's important to summarize what corrupt care is. And really, people will write books about corrupt care, and it's deep and it's big, and it goes into not just our hospitals and our procurement. It goes into Recovery Alberta. It may go into our education system. The funding and the sole source contracts and the things that have been happening, it's massive. But why you should care in a healthcare lens is, essentially, this government came in, fired the CEO of AHS, fired the AHS board, fired another CEO, brought in another board, brought in a handpicked CEO, and essentially told that CEO, we want you to cut a bunch of money out of the acute care AHS system. We want you to prioritize lots of surgeries in the chartered surgical facilities. And we want you to run this system, and we trust you. And that CEO, Thana Mentzelopoulos, she started doing that, started looking, getting familiar with everything. Lifelong bureaucrat, very smart, very skilled, hard worker who knew the system. Started looking, and what did she find? She found right away, she started asking questions like, I have empty ORs. I have empty operating rooms in all my major hospitals. My cancer care times are going up. My times for cardiac surgery are going up. My times for, trauma surgeries for broken bones are going up. My bowel surgery stuff going up, and I have empty operating rooms. What's happening? Why can't we staff them? And started looking and seeing, well, they're being forced to pay money out of that same public pot to do more and more surgeries in these chartered surgical facilities that are all lower acuity. And then she started looking, saying, well, wait, if we looked at the exact same surgery, so a knee, let's take a 40-year-old man who needs their knee fixed and do that surgery in the hospital versus do it in a chartered surgical facility, she could see the contracts. She could look at these contracts that the public don't get to see. We don't get to see the numbers. It's all redacted. There's no transparency. She could see them and say, hey, we're paying like 4 times more to do it in chartered surgical facilities from the same public pot than if we did it in our facilities. So she actually then said, well, let's get some forensic accountants. Let's get some independent people to look at this. And they started collecting evidence and took this up to the Minister of Health, took this to the Premier, to top levels. And then what did they do? They fired her. And they fired her without cause, dismissed her. And that message, I have to tell you, that sent a chill across everybody across the province, because first thing it told everybody that's in healthcare is, if you speak truth to power, you'll be fired. The second thing it told everybody that was working in these is that, you can't collect objective data. You can't bring it up to these people, because if you do, you'll be accused of being ideologically driven or against what their mandate is, and you can't even use objective evidence. And then I'm not even touching on, at the same time, she was looking at, in the same contracts, the same people, $70 million spent upfront, paid in full for Tyler's Turkinol. I said Turkish Tylenol, Tylenol. It was medicine that at the time we had a bit of a shortage, and it was an issue. And there are memos. AHS top leads said, "Do not buy this medicine. The shortage will end sooner than we think. We'll get it federally, but the second piece is very expensive. We might not be able to use it. Do not buy this." And the minister at the time, directed by the premier, said buy it and do it, and spent $70 million upfront, got about $10 million worth of product that ended up having to be wasted, that we spent more than $1 million to store and destroy. And there's 42, $45 million outstanding that's been in somebody's pocket in MH Care's bank accounts for over 2 years, unaccounted for, and the government just shrugs. But why that? All of those pieces. So you talk about 70 million in Tylenol, you talk about 500 million to $1 billion in these sole source contracts to all these different chartered surgical facilities and Recovery Alberta facilities, and it's all in the background. There's no transparency, there's no accountability, and that money is not going to you and your loved ones, and keeping your hospital open, or making sure you have a family doctor in your community, or making sure that when you have appendicitis, like right now, when people have appendicitis in Calgary, sometimes they'll go to the largest hospital, like Foothills, for example, and they don't have a team. You get diagnosed with appendicitis in the Foothills, and they might have to call an ambulance off the street to take you to the Peter Lougheed or a different emerge department in Calgary, because they don't have the team. It's called diversion. It's a formal process we have. But you won't be able to get the time that, the life-threatening and limb-threatening care that you need in a safe and timely manner, so that we're hearing more and more examples of tragic cases like Mr. Sri Kumar, and we're seeing it more and more every day. And I just want to say, when you think about all of these things that have happened in the last 3 years, objective. I'm not talking ideology. I'm talking objectively what has happened to our healthcare system. That is why we're in trouble. That is why I believe it's not going in the right direction. And I'm gonna wrap up shortly here and hand it back to Chris, because we're gonna give some solutions and things we can do. But I want to say and end on a positive note, is that it's not too late. We have some amazing people in this system still that have good ideas. We have experts that have excellent ideas. We have to start listening to the experts that are on the front line. I mean, even as much as like Thursday and Friday, they're rolling out Bill 29, and they have these consultants from think tanks arguing with me online, saying that, when I mentioned that we're not prioritizing life-threatening care and making sure people with heart attacks and strokes and our life-threatening surgeries are being done in timely fashion, we have consultants telling me that our frontline reality is not true, that we are prioritizing it and it's all perfect. And if we end up doing more, more private care is going to make everything better. The government's doing the same thing. So when we announced a state of emergency in January, and then came out and said, listen, we are in state of crisis, we need help, we need to address this, had over 200 emerge docs and internal medicine specialist docs sign a letter saying we need help, sent them 6 deaths and 40 near misses. What did the government do? They sent their PR team out to gaslight us, tell us what we're saying is not correct, that we don't know what we're talking about, and then take over 10 days for the Minister Jones to come out and actually say, well, no, maybe they did know what they were talking about, but it's not a state of crisis or a state of emergency. It's just extreme pressure, extreme stress. Maybe we thought we had an integrated, coordinated system, but now they're coming and saying, well, we don't really. We've got to try to fix that. Maybe what the frontline people were saying, had some validity. So we have answers and solutions. We need to demand transparency. We need to know what hospitals are closed and emerge departments are closed, what obstetrical care we're losing, what communities, how many people don't have family physicians, how many emerge inpatients are stranded in emerge departments across our province, how many alternative level of care patients are stranded, not being able to get out of our hospitals into the community. We have this data. They've got to show it to us. is the trend going in the right direction or is it going in the wrong direction? Are the changes they're making improving it or not, are making it worse? Are we need accountability? We need to know who we can go to when things are not functioning, even from the front line all the way up. But then we need real, true, meaningful accountability. Our system's getting worse, and everyone's shrugging and pointing that it's some other minister's problem. And then, like I said, we have to go back to listen to the experts. And I'll just wrap with the final piece of I wish we were in person. I wish we could talk a bit more frankly back and forth, but we'll try to get some questions and answers. But I'll say that I think what I've started this conversation with is that I realize that no one person can roll that rock up the hill and force the government to really focus. What are our priorities? Do we really think prioritizing our lowest acuity surgeries and care for the richest people who can pay and jump to the front of the queue, is that our priority as Albertans? Or do we think we should have life-saving, care in our hospitals, in our emerge departments? Should everyone have a family doc? Should you be able to have obstetrical care in your community where you're working to drive the economy for Alberta? Are we prioritizing the right things? But I know that I can't make enough of a pressure that I need you. I need everybody on this call to start, advocating. And first thing first is just talk about it. Start telling your stories. Talk to your friends. Talk to people and say, hey, listen, I know, I don't care how you vote this way or that way. Do you think healthcare is going in the right direction? Do you think we're doing the right things? And then from there, the other piece would be, the more and more it used to be, I would say that, there's a hesitancy for when people had long, long waits and bad outcomes that they didn't want to complain because they were just so thankful when they saw me or my team or the surgeon and they finally got care. So they didn't want to make it look like they were trying to cause trouble for the healthcare workers, and that used to be. But now we're actually, a lot of us on the front lines are begging families and patients, tell your stories, connect, tell people what's happened to you, tell people that you or a loved one maybe got diagnosed with, came into emerge and saw a doc like myself or one of my colleagues, and we find a new big mass in your liver, and we think it might be cancer, but we have to do some tests before we can, some imaging, so maybe an MRI or a CT scan. And then once we get those, then we have to get you to an oncologist and a cancer specialist. But it could take months to get those special tests, and it could take 4, 5, 6 months to get to see an oncology cancer specialist. We used to have the wait times to see a medical cancer specialist and a radiation cancer specialist. Government stopped publishing it because it got worse in the last 2 years. So now people don't even know that this is happening. We need people to tell those stories, tell what the impact was, get out there and start discussing what's happening with healthcare and saying, what, do we have our priorities right? Are we going in the right direction? And if we're not, then we have to demand from government that they correct this course, and that we get off the path and trajectory we're on, which is going in the wrong direction, and that we improve things. So at that point, I think I'll try to be hopeful to say that I think as more of us talk about this, as we engage and listen to each other and see what's happening, I think we can change the momentum here and spin things around. So I'll pass it back to Chris. And as I said, I haven't monitored the QA or Q&A or anything, but I'm happy to chat and answer some of them now. And I think Chris is going to give you some specifics as to how we can really get active and get mobilized as well.
Absolutely. Thanks, Paul. This is normally where we would pause for applause and everyone would thank you for giving your time. So I'm assuming that's happening virtually right now. But before we get to the Q&A, I see people are putting their questions in that Q&A box. Thank you for using that. While we have over 200 people joining us on a sunny Sunday, I want to mention a couple actions you could take if you're feeling concerned with what you're hearing today that we'll put into the chat, because it's very clear to us that we're facing down a move to two-tier American-style healthcare in Alberta. The legislation has been put forward. They're pushing ahead, and they're using that, classic strategy where you break the system and then offer up privatization as a solution to do it. So while you're all here, if everyone today takes these actions, you'll help raise that voice. So we have an email tool you can use to email your federal MP and the health minister to say, enforce the Canada Health Act. Everything that's happening is a very clear violation of that act. I'm sure we'll have some questions about that, but we need to push our federal government. We have a provincial tool as well to push back, and a campaign that we're running on rebuilding our healthcare. So it identifies the issues as well as solutions. You can share your stories with us that Paul was just talking about. We're collecting stories to use, and you can also message your provincial representatives. And I also want to mention that you can join us as a member if you haven't already. Friends of Medicare, we're a nonpartisan nonprofit society based here in Alberta. We're not a charity. We don't get government money. We don't get corporate money. We're able to have events, tour the province, do this work because Albertans who care about public health care join us. So for $20 a year, you can buy a membership. You can be part of our work. The link's in the chat. And I'll just say I'm feeling optimistic for many reasons, but we have had over 500 brand new people join us for 2026. People are increasingly worried about healthcare and getting on board. So consider helping us double that, and we'll get to 1,000 new people this year. Why not? We can do it. And also as part of that, we always need volunteers. So you can sign up to volunteer, or if you live in a community that has one of our local chapters that does work at the community level, tabling, having events, being out in public, you could sign up to join the chapter in your community to do that work. But we're doing work across the province right now to try to reach as many people as possible in their real lives, in their community, at markets, at events, door to door, whatever it is, to try to reach as many people as possible. So consider signing up to volunteer, and we'll reach out to you about how you can help us out. And I'll just say it, I'll get to the questions in a moment. I am feeling quite motivated by doing this tour that we've done. We've had thousands of people come out and join us on tour. But we also know when you look at things like the polling, that the vast majority of Albertans agree with us. They're unhappy with what the government's doing. It's the top issue in a series of polls recently. Healthcare is by far the top issue in Alberta that people are concerned about. And to us, that's an opportunity to go have those conversations, reach more people, get them active, tell them what's happening, and ask them to get involved, because we can absolutely push back and get our public health care protected and so on. So I'm feeling quite optimistic with the response, and remembering that nobody in the last election voted for this. The premier didn't run on this. She ran on protecting public health care and a public health care guarantee, and is now implementing a very different agenda than we were promised 3 years ago in the election. So it's our opportunity to reach more people, get them keyed in, get them concerned, and get them engaged. So please consider joining us. Please take a moment while you're on this call to send those emails, take those actions, add your voice, and show that thousands and thousands of Albertans are concerned about what's happening and want better. But with that, we'll go to the Q&A, and thank you to Carly and Trisha and Alyssa from Friends of Medicare who are helping in the background to keep this orderly. So the first question to you, Paul, is kind of a two-parter. It's about rural physicians. Rural communities have a more difficult time recruiting family physicians, of course. What can we do to help rural communities recruit? And the second piece of that is specific to OBGYN and those services that are also such a struggle in rural communities right now. What can we do to help with both of those things?
Yeah, it's awesome. Yeah, and I really appreciate the questions too, because one of the things I always say is I could talk on every single one of these topics in healthcare. Healthcare is quite complex, and so I could talk on for hours on each of these individual pieces. So unfortunately, a big part of this talk is to just start talking and having some of these, and that's a perfect question in the sense of, it's one thing I say a lot, that first off, we don't actually, I'm not even exaggerating to say that we don't have a workforce plan. We don't actually have a coordinated workforce plan in this province. What they did too is broke it up. So here's a good example. When they broke up the silos, I've had conversations with the Minister LaGrange, who's Primary Care Alberta, who is I'd ask her who's going to recruit family docs for the rural communities, because those family physicians are rural specialists who actually will have an office and take primary care, but they'll also work in the hospitals and keep your hospitals and your emerge open. And she's like, "Oh, I do it. I for sure do it. I have a team. I do it." And I'm like, "Well, who in your team's doing it? Can't tell me who it is." But meanwhile, I go to Minister Jones, who's in acute care Alberta, and I ask him the same questions around who's going to make sure you still have your emerge departments open, because those are staffed by family physicians that are rural generalists. Who's going to make sure you have GYN services, OBGYN services in your community so people can deliver? And he's like, "Well, I do that." because of course that's in my portfolio and he can't point to who's doing it, and neither of them can figure out how they're going to coordinate that. That's how in disarray we are in right now. So what I would fall back to again now is I use the example of, it's crazy to think that if you thought about healthcare as like say a $30 billion company, how is it possible that we have a CEO and we have people that are running our healthcare system, and they do not know where their employees are, what kind of care their employees are delivering, and where they need employees. So the first step would be transparency around a needs analysis. What communities are really struggling? How could we do unique things to make sure they got family physicians? Second thing we could do is have a coordinated, concerted workforce plan and determine who's accountable for it, who can come back in a month or 2 months and report how things are going. Those things don't exist. And then the third piece, I started my AMA presidency as a merge specialist, but advocating for the entire year of, we had to change the funding model for family medicine. We have to prioritize the foundation of family medicine. We're starting to do a bit of that work, but we have to build the teams. But without transparency around where do we need doctors, and without an accountability framework and someone to actually have a coordinated workforce plan, those communities are going to go into that vicious cycle as they lose docs or go longer and longer without physicians. They burn out the ones they have, lose more, and then hospitals close down, gynae services close down, so you have to go hundreds of kilometers to get any care to be able to deliver your babies. It just is a vicious cycle that our government doesn't have a plan to address.
Absolutely. The need for workforce planning is so clear. I'm going to do a few kind of together that focus on federal and the Canada Health Act, and I'll make a comment and then I'll throw it over to you. So there's a few here. I think it's a very sad day for democracy when groups are forced to lobby the government to enforce the law of the land. How can we force the federal government to enforce the Canada Health Act, as is the law? And then a second piece to this, there's a few batched together. Is anyone suing to stop the implementation of two-tier healthcare? And this potentially dangerous plan to allow people to pay for testing without a doctor's order. And then why is our federal opposition, the NDP, so silent on this matter? I'll stop at that and just make a comment and throw it to you to talk about the Canada Health Act. But the email tool, of course, is in there. So do that. Help us. We know they're feeling the pressure. We've directly lobbied MPs where we're doing that push, but we all need to push on that. In terms of lawsuits, you will see a legal opinion about Bill 11 very soon that will be released publicly that makes it blatantly clear that this is a wholesale violation of the Canada Health Act. But in terms of the courts saving us from this, we have a political problem in Alberta that we need to solve, that we need to push back on. There's legal options that we will all explore, but relying on the courts and a 7-year charter or some other court challenge to the Supreme Court, there won't be healthcare left to fight for by then if we don't push back now. So I just caution against relying on the courts. And I would just say, in terms of at the federal level, Heather McPherson asked a question about this again on Friday. She's the only NDP MP from here. We've also had senators, Christopher Wells and others, asking questions in the Senate. But there has been a lot of silence at the federal level on this from anywhere else. But in terms of the Canada Health Act, and you're on the front line, maybe you want to talk a bit about what we can do to try to enforce that act or other ways to stop.
Yeah, absolutely. So well, it's an excellent question. I'll tell you that one of the pieces is why we're having this conversation. So we have to have all of Canadians and Albertans outraged and saying, hey, this isn't what we stand for. This isn't our priority and demand. The feds won't want to act on healthcare if they can. And there's a lot of political tensions, and Alberta is intentionally, there is no question that what they're proposing violates the Canadian Health Act. There's no question at all that this will be, prioritizing people with resources and money to get at the front of the queue, and it will disadvantage. So already today, right now, I see cases as examples of patients, with maybe a first diagnosis of a brain tumor coming to emerge with a seizure, that in our system right now, It could take days to get, some of the really urgent testing in our hospitals, and they have to spend days in the hospital to get that testing for something that could be life threatening and save their life. But then months to get the specialized MRI and months to get the specialized EEG. And the government's going to try to sell to you all that, oh, you know what? If we take those techs that are doing the MRIs and the techs that are doing the EEGs in the hospital right now and move them all and let the rich people have them fully, servicing people with headaches and people with not life-threatening things, but want to get these tests, that all of a sudden that's going to make that queue better. And it isn't. And it's going to impact every single Albertan, because the people that have those tests, but then they get stuck in hospital, then when you have a heart attack or a stroke, you're not going to get into the emergency department in a safe and timely manner. You're going to be stuck in hospital. It's going to impact everybody. So we got to start talking about it. We got to start writing about it. Last I looked, the Liberals are in charge and they support public funded healthcare, as far as I understand, as part of their platform. So do the NDP. I even think the Conservatives say they do. So, but here's the point: is it's not actually. It is political. It's not partisan. The Canadians believe in fairness, equity, access. They believe in healthcare as part of our core. The government is selling us this fake, false choice. They are setting us up, and it's totally this false dilemma of our public system's so bad, so the only thing we can do is private. I think we all have to kick and scream and say enough. I think there is a window of opportunity that the feds could get involved in certain ways to really help all the provinces that are struggling, as people make a push to make them, demand better. But then I'll say again locally, I didn't say off the front. Chris kind of mentioned it. I'm speaking just personally for my own. I'm volunteering my time here. In fact, I had to pay money to be a member of Friends of Medicare to be able to. I obviously would do it, but I joke that I had to pay to be able to come and talk to people on these town halls. But the point of this is, I'm not representing anybody, but I am representing, hundreds and hundreds and hundreds of my colleagues that I work with every day that don't feel safe to speak out, and I'm representing, I think, thousands and hundreds of thousands of Albertans and Canadians that support robust public health care. I think we just have to mobilize and have enough. And so the reason I said that, though, is I would get criticized of being partisan, because I'm criticizing the one government that is running Alberta healthcare and our healthcare right now. But it is political, but it's not partisan what they are doing. If they're not putting us in a direction that is going to put healthcare in the right way and is going to be fair, equitable, and work for people when they have life and limb-threatening illnesses, it's our job to make noise. And we can't wait until court cases 7 years. We can't wait to an election in next September, probably, because by the time they dismantle so many chunks of our healthcare system, it might be hard to get back in Alberta specifically. We got to make noise and start talking about this now. There's many things that we can add, but I think, tying it into some of the other key piece, healthcare is really number one, but so is affordability. And I just want everybody listening to this. Every single thing they're proposing about healthcare is going to make it more expensive for you personally. Whether you have the resources or not, it's going to make it more expensive for your pocket, So it's going to impact your affordability and your healthcare. And those are the two things that no Albertans want. So I say let's start kicking and screaming collectively together and demand them to do their job.
Great. And it's always good to remember that Alberta is getting over $7 billion from the federal government for healthcare this year. So they do have some leverage in terms of enforcing that act if they chose to use it. So this is kind of a chunk of questions about workforce. So I'll just read them all, and you can try to memorize them as I go and answer what you will. But so given the impacts of the refocusing and restructuring in terms of the chaos, the pressures on staffing, blocking access, how would you recommend we repair the system without burning out staff with more organizational changes? Or is transformation necessary to get the system back working? And then a follow-up from a frontline worker says, as a frontline staff, I'm curious what we can do since all of this restructuring is already underway. And then the final piece of that is, do you foresee massive labor shortages for frontline staff like allied health, techs, MRTs in the future? And do you hear from people that are talking about leaving the province because of all this?
Well, I'll start with the last first because it's in my mind, and so yes, the massive shortages Yes, like so part of it is going to be driven internally, massive shortages in our public system because of what the government's doing with private delivery. So we know it. We can 100%. We're already short. They're going to make our public system even more short with their plan. But in addition now with the chaos, the refocusing, the system getting harder and harder to work in, there's a global shortage, but there's also nationally we're competing with, BC and Ontario and Saskatchewan for the same workers. If our environment is so chaotic and our government and our premier keeps leading around, it seems like she hates healthcare and healthcare workers, and she talks about like we're a problem. She talks about the people administrators running the system. She said she's going to walk through the halls and chop off heads and fire people if they are not doing a good job. That, and then she fires a whole bunch of leaders and the CEO and goes around and kind of vilifies people who are trying to speak the truth. That climate is never going to welcome in people to recruit into our system. So we are already in massive shortages, but the current environment in Alberta is going to make it harder. And let me give you one just concrete example. In the United States of America right now, there's a funny thing going on with a funny president there right now, and our government wants to emulate a lot of things that he's doing, maybe not the exact same but emulating it. But this is just fact, not me arguing ideology. If you think Trump's good or bad, or you think we should separate or not, right now there are lots and lots of doctors fleeing the United States. They do not want government telling them how they should practice. They don't want government to interfere with the evidence-based models. They really don't like the environment. They're fleeing, and a lot of them are coming to Canada. And stats are showing a lot of them are coming to Canada. Take a wild guess what's the only province in Canada that is not getting those doctors fleeing to us? It's Alberta. They see Alberta as similar to what they're fleeing. So BC's getting a bunch. The Maritimes are getting a bunch. It's a good example of where the current environment is going to really hurt us, but then amplify it for all workforce. Like, so I'm not just physicians, but nurses and respiratory therapists and everybody in our chain. And then frontline staff piece is critical in that. And it ties in the first question about focusing in more org. So let me just say it straight out. It's the most chaotic it's ever been. I've been in Alberta working in this 25 years, 26 years. It's never been this bad. And I've never heard anybody tell me anything to the different that's working on the front lines. They just spent 2.5 years of mass chaos, reorganizing everything with no plan, with no change management, just blow it all up and then start to put pieces together. So no, we don't need to come and get a new government in and have them blow everything up and bring it together. That would cause lots of death. We'd lose lots of more workers and it'd be bad. But we have smart people that could tell them some of the things that we've done. There are ways that we could reintegrate some of the key pieces, but I'll go right back to transparency, demand how is our system doing, demand that they show it to us, because we have to show that the changes, are they making things better or worse? But accountability is totally missing in this system right now. It is insane. There's no board. There's no healthcare board. Never had that in a $30 billion service. There's no board with arm's length from the premier's office. On a whim, the premier's office is making operational decisions about what happens in a massively complex system. But then here's why there's no accountability. She's running it out of her office. Her staff is running healthcare, but anything and everything goes wrong, she tries to blame the system and blame the people delivering it. We need to reorganize this org. And when I say reorganize, it's gentle. It's like we bring it together in certain clever ways that has true accountability framework. So we've asked, as an example, one example that's real for everybody to know right now. We called the crisis and we said, please help us. After Mr. Sri Kumar's death, they did a formal review with lots of recommendations. In those recommendations, one of them was, and keep in mind that the premier hates Alberta Health Services. She said it, and she hates it. So I'm not putting words in her mouth. She doesn't like Alberta Health Services, but she seems like Covenant Health. Mr. Sri Kumar's death happened at Covenant Health. And Covenant Health has recommendations. And in there, one of the recommendations and the promise by Minister Jones was to have a triage liaison physician, so an emerge waiting room doctor in our major emerge departments to try to mitigate and help as a band-aid to not have these happen. And we as a group of emerge physicians, I was at the meeting, we all met and said, we're willing to do some extra shifts. We're willing to work overtime. Let's figure it out, but they got to get the contract going. And there has to be some specifics in this contract that protects us because it's hard work. It's a very different work than what we do because you're out in the waiting room. Anyway, fast forward, they have recommendations that they've accepted. You should have a TLP. They have not met with us. There is nothing happening on this triage liaison physician because Minister Jones doesn't make any of the funding decisions. Minister LaGrange does. And Minister LaGrange is in primary care. And I think Minister LaGrange has to go to the Premier's office. And nobody has met or done anything for 4 months on a critical next day's band-aid solution that would help save lives because there's no accountability in our system. So I could give 1,000 different examples to everybody out there listening. If you happen to be a frontline worker in Recovery Alberta, I know you live it every day. You're experiencing that. If you're in cancer care Alberta, if you're in any of the other arms, you're living exactly what I just described as a little microcosm in our merge department. You're living it, and we have to correct that quickly. But we have plans, we have ideas, but they're not listening to us. They're listening to think tanks in Montreal. They're paying $1 million a day to consultants that never step foot in a care space, and it's really hurting us in Alberta.
Great. A short one. I'm very worried about this government selling our public hospitals. Is this a realistic concern?
They've said they're going to do it. She said she wants to do it. So I want everybody, I'm going to really be very careful with so I want to be very clear when I say stuff about what the Premier has said, it's not me guessing what she's thinking. She said it. She said it publicly. And so, yes, we should be very worried. We should be very worried that what we're doing right now. So when I say transparency, this is taxpayers' dollars, that your money, my money, us, we're paying money. It's going federally. We get a bunch of it back, plus our provincial taxpayer dollars going into healthcare, but we don't even see the backroom contract deals that they're making with private facilities. They want to have private urgent care centers that are run in, say, for example, Airdrie. They're promising one in the Medicine Hat, which it wouldn't work and we don't need it. And they've not talked to anybody who does emerge urgent care in Medicine Hat about it. But they want them run by private companies. It would not be a stretch to see our hospitals all of a sudden be sold off to like Google or to London Drugs or to some big pharma like shop, like when make any company you can think of where they sell. But here's what's happening when they do these side contracts is that they're up in Beaver Lodge. Everybody should know this. It's up by Grand Prairie. They built a hospital where it was private contractors going in, own it and run it, and a lot of public money went into it, was paid into it. We don't own that facility now, and we'll be locked into years and years and years of higher contracts to run a hospital that we no longer own. And so I'll summarize that yes, 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 we should be worried about this, because what I've heard very senior people in government say is that the analogy of that we're selling off all of our cows, and then we're going to buy the milk back from the people we give the cows. They're selling them for $1, and we're going to buy the milk back at 10 times the price for 20 years. And we might be in a scenario where Alberta doesn't own any of our hospitals and any of our schools. The two things that I think are fundamental, like truly our fundamental public safety net and public services, we might not own any of those facilities with the plan that this government has already put in place. So I'm not guessing what they're going to do. They've told us this. So yes, we should be worried about it. And maybe I'll just say, and I know I always talk a bit too long, but my question is, because why we should be worried, let me give you another concrete example. I just want to talk about objective things that have happened. We did this with Dynalife. We did this with the labs. Major, huge super lab was going to be publicly run. Dug a hole in the ground, got things going, wasted millions and millions of dollars to reverse that. The Kenney government, UCP, gave a contract to a private provider of Dynalife, and a couple of years in, it almost collapsed our safe and timely lab and diagnostic for our hospitals. That this government, this current premier, had to fully reverse and waste hundreds of millions of dollars to get back our public lab. Because they showed they couldn't do it with the for-profit and in a private way. But regardless of, in spite of that massive failure, this government's doubling down on selling off all our hospitals. So yes, we should be very concerned.
Yes, and Bill 55 that passed last spring, it was a direct setting up the legal framework to sell off our hospitals, and we'll throw a link in the chat to our hands off our hospitals information on our website where you can read the timeline and concerns, because yeah, it's coming and it's worrisome. So that is there. So we'll go to this one. We're going to keep going for a bit. There's some more questions to get through, so we'll see how many we can get through tonight. But we've had lots of people sharing stories around wait times. The one I'll read is just, I'm so worried for my 55-year-old daughter who has a broken hip along with other conditions. She can't get a hip replacement for about a year. I'm worried she may be dead by then, which is a story we're hearing a lot right now. And just a question to go with that story, because they're connected, is the government says having private clinics will shorten wait times in the public system, but many experts say that will in fact increase wait times. Can you share your thoughts?
Yeah, so first, I'm sorry to thank you for sharing that story, and I'm sorry it's happening because I think more Albertans need to share those stories. Sad it won't be comfort to anybody here, but that is one of thousands of cases that I'm seeing regularly, and my colleagues are seeing regularly, where we could do much better, but we're on the wrong track, and that's getting worse. And so, but we need to talk about that more because it is happening, and some of these complex some of these more difficult and complex surgeries, I want to say it again, if it will kill you, you can't be done in the surgical facility. So we know that putting all of our eggs in that private chartered surgical facilities is going to leave us with a massive gap that really impacts a lot of people's lives. And so, we should be very concerned that that's happening. And then I would say that the key piece of this now, though, on the wait times, and what was the question of the second part of that, though, Chris? It was specifically around how, like, what should we do about it, or
Well, so the government says it'll shorten wait
right,
times, and
right,
experts say it
gotcha.
won't. Yeah.
So yeah, so in fact, it's very interesting is that that goes back to, thank you, that goes back to what I was saying about the transparency is now. So right now, let me just tell you that our objective wait times for cancer surgeries, for our major cardiac surgeries, and our bowel surgeries, objectively out there, are all getting worse and all going in the wrong direction, while Alberta doubles down because those surgeries can't be done in a charter surgical facility. They're all getting worse. And so we have to demand. So this, every time the premier stands up and the ministers stand up and talk about how they're going to put more money into these private plans and do these more plans, we have to demand to them, show us your plan. Show us what you're paying. Show us how it's going to be get better, and then show us the data. Prove to us it's working. Because 2.5 years now, as soon as we start to speak and show them that it's not working, a couple things happen. They take the data away from us, so we even experts can't share it. Second is they fire loud people like that. If I'm sure if they could fire me, they would have fired me by now if I was in an administrative position. All jokes aside, I would never get an administrative position with this government, despite 25 years of leading in emerged medicine, as an example, because they do not want someone that would speak truth to power. But here's the thing: is that they just keep on selling us something when we have objective evidence and data that it's not working right now, and it's not happening in Alberta. And then the second thing they do, I want to tell you, these guys talk about red tape reduction. They have their own department of red tape reduction, but somehow objectively they're the biggest government Alberta's ever had, biggest cabinet, spending the most money, created the most amount of bureaucracy in healthcare, and now they've got think tanks telling them, hey, we should do more private stuff out here. And these think tank people are shadow bureaucrats they're paying money to tell them this, because then what's their answer? To say, hey, you know what, we're going to try to, maybe Parks is right about this, or maybe some of the other doctors are right about trying to protect over here in the healthcare system, in the public system. So we're going to create, guardrails, and we're going to get registrations and regulations, and literally we're going to have, like, what are we going to do? Have to get the red tape reduction department to create a whole bunch of administrators to monitor the rules and to make sure that the for-profit companies aren't skimming the cream, aren't not following up with their cases, are doing the stuff that the regulations are set up. I think everybody here smells BS when they hear that more regulations is going to make the government smaller, less bureaucratic, and going to work for us. So we got to start talking about this and saying it doesn't make sense. What they're selling, we ain't buying.
Great. And I should mention, because I think I forgot to earlier, this is being recorded. We are going to share on YouTube the webinar of this, and we'll have some clips and stuff for social media. So for those who might have to leave or weren't able to make it, they will have access to this. I know a few people have been asking in the Q&A, so look forward to that. This question is kind of a good segue from the last one. We'll probably only have time for a couple more batches of questions, but we'll see what we get through. But this one was, how come Dr. Parks hasn't been silenced or fired by the government? But also, are there other doctors supportive of what you are sharing today?
Oh, so I mean, yes. So is it a problem? There's a bit of it, yeah. Like so, simplifying, there's lots and lots and lots of my healthcare provider colleagues, both physicians, nurses, allied. Every day I'm in connections with lots and lots of people sharing their concerns, even senior administrators, people that don't feel safe to voice concerns right now. That's the environment we're in. I want to tell you, corrupt care, them firing the CEO that they handpicked, and then actually actively in the public try to make it sound like they fired her because she was incompetent. They fired her because she wasn't doing your job, and now we're spending our dollars to fight her legally in court, spending millions of our tax dollars already to fight her. That sent a chilling message. People don't want to talk. People don't feel safe. Nurses and allied healthcare workers in the front lines can't. They feel like they'll get fired or lose their job immediately. You have to think in this government. So again, objective facts. There have been very senior people that this government has fired and made it clear they can never work again in this province. Happened in public health, and they actually directly interfered and didn't let a physician come back to a different job in this province. It's very sinister. And it's growing. And so we really are in the state now where there are very few people that will tell the Empress she has no clothes on and that what they're trying to do is not working. And just to go to me personally, yeah, again, I think I work clinically in the front line. I'm going to have shifts tomorrow. I try to just always speak truth about the big system, but I do, as an example, when we did our state of crisis, I asked my colleagues across the province to give some real cases, about what they're seeing on the front lines, send them to me quick in days. Many of them did because they all share the same concerns and they talk to me every day in many different ways, and we're connected about this. And they sent these cases, and then when we sent them to the government, I've got feedback that the first response was to say, hey, like, can we minimize and pretend that these aren't real cases? Can we try to make it sound like Dr. Parks is making them up and doesn't know what he's saying? And then they did that in a little bit of a way. They sent their PR team out and actually said that we're misguided and that we didn't know what we were talking about, that I didn't know. And so, so just to answer for me personally, that's why I'm doing these town halls. I'm not being paid. I'm not representing anything. I want to have real factual discussions with Albertans. I don't care how you vote. I want to have a conversation with you and say, hey, these are from the Premier's mouth. This is the Premier's actions. These are the things that are happening in Alberta. This is how I'm seeing it, and my colleagues are seeing it every day on the front lines. This is where cancer specialists are calling me up or texting me. This is where I have trauma orthopedic surgeons texting me and saying, listen, in a big major trauma center, Paul, we've never had, where cases should be done in 2 hours, we have 28 of them and they're taking 3 days to get to them. We've never seen it this bad. So yes, I'm confident that my colleagues share the concerns, and my strategy's solely been to just be so vocal and speak the truth and speak factually that I just try to remain protected if I can.
Great. Yeah. And, we've been lucky on the tour to have in many communities local physicians who've joined and spoke as well, to talk about what it's like in their community. And we've had the Canadian Medical Association join us at press conferences in Ottawa, really pointing to their concern about Bill 11 and what's happening in Alberta. So there are those who are speaking up how they can. And I just noticed in the attendees and that Dr. Luann Metz is here, who's a sitting MLA in the legislature, who's working on solutions to our public health care. So people should reach out to her as well to share their concerns and their solutions, as an opposition MLA from Calgary, who's also a physician. We kind of have a batch of questions about what to do about this, which I think will be a good batch to kind of do a wrap up around. So There's one here. I'll read. There's, I think, three of them, and then I'll throw it to you, Paul. So I work in the Red Deer emergency room as an LPN, and we have many examples of this. But of course, we are gagged. How do we get these stories out? The near misses are only a matter of time before they are deadly. And then there's a few questions about what's the best way individuals can do to bring awareness or change right now. How do we help get back to a good medical system? And yeah, similar. How do we demand accountability? So a whole bunch of questions around like, what should we do? How do we do it? What should we be saying? So in that context.
Yeah, so big broad, first off, big broad, start talking about this. And now I think we're starting to encourage patients and family members to talk about it, but just talking to everybody, tell your experience around what's been happening for you or your loved one. Like even examples too though of, you go see your frail parent who's stuck in a hallway and emerge for 7 days. Lights don't go out. It's never quiet. It's chaos. And they start to get delirious from it. And you recognize and see that they're getting delirious from the care that they're in because of the care environment. Start telling that to people, because people don't believe it until they access it and see it. They don't really know what we're dealing with. But so just everybody starting to talk about it and saying, does this seem right? Does it seem right that, my friend who has a new tumor in their abdomen has to wait 6 months to see a cancer specialist, things like that. Just start talking about it. I think that's critical. People who have confidence and feel comfortable talking to the press, sending these stories to Friends of Medicare, healthcare colleagues. I always, tell them to reach out to me, like the Red Deer examples, for example. I talking to your docs at your group, and I'm very aware that, and very unique challenges that the government's aware of where you can have, I'm aware of cases in Red Deer, for example, of people going, with heart attacks and spending days in the emergency department because there's no specialist in the hospital, bit too sick there, but too sick for the floors in the hospital, need to be shipped out, but can't go to Edmonton or Calgary, and things are escalating. But then more and more stories of those cases that are in the emergency waiting room. And so one of the things that I always say is, I think so, healthcare workers is especially trying to connect them with section of Emerge and myself and trying to get them out because it really helps for us. As healthcare workers, they're not our stories to tell. We have to protect confidentiality. We try to anonymize them. It is very hard if you're in a one hospital town like Red Deer, for example, that you can connect those cases pretty easy, because people know people. So part of it is sharing it on a provincial level, like we've been doing, where we anonymize it, and then people don't necessarily know, what was that patient that had a bowel perforation that went septic. Was it in Red Deer, or was it in Lethbridge or Medicine Hat or Edmonton or Calgary? That helps a bit, but I do think we need to collectively within our group start to. There's a lot of burnout. There's a lot of frustration, and a lot of times I do have to give a huge shout out to any of my healthcare worker colleagues that are out there, my nurses, respiratory therapists, OT, everybody that's out there, because I know every day they're working in environments where they're shorthanded. They have more patients than they ever would have. They're way more complex and way more sick. And maybe a ward that would have 10 nurses has 6, and maybe if they'd have 30 patients, they have 40 or 45. Like those environments, you're just treading water so vigorously to stay afloat that you don't have time necessary to collect the cases and share them and distribute them. But I think we have to keep doing that and socializing and getting that to happen a bit more. So on the front lines, encourage the families if they have members with them, encourage them to tell the family members of that, to encourage them to tell their stories if they're comfortable to do it. Sending them through to myself in the section helps. Sending it, Friends of Medicare is collecting as well, and they can share some of these with me that I can socialize in an anonymous way as well. And then just all of us talking about it more. I think we got to lift that taboo off of it now. I think actually I'll just finish on that. If I've had my colleagues recently, for example, we all hate, everybody hates to hear of like Mr. Shri Kumar's death in the Grey Nuns emerge. That's devastating to the team. There's no triage nurse that ever shows up to a shift and says, I can't wait to make someone wait in pain for 8 hours. Or I can't wait to make a whole bunch of people with chest pain wait forever. And nobody wants to do that. We want the system fixed. And so it's very devastating for the team to hear that case, or to hear about a patient getting stabbed in the waiting room in the Royal Alex, or then more colleagues in Calgary telling me about similar incidents where a stabbing almost happened in the waiting room, and in another hospital emerged where security guards were injured because of violence, and then other cases. But as those come out into the media, um, that I hear from my colleagues now that they're actually relieved that some of these stories are getting out there. So then we can add our voices and say, yeah, it's real. We're seeing that all the time. We've been telling the government. So I want to tell everybody here, I'm on this tour after having spent 3 years begging this government to listen to me, to telling them these cases and these stories, and telling them, please work with me, or let me connect you with my specialties. Please work with us. So now we're in this scenario where we just have to get those stories out in the public, because nobody believes, thinks that that's right or that's the right direction. So I'll just say, keep speaking out, keep showing up, and just protect yourself, though, because the climate is difficult if you're a healthcare worker.
Absolutely. Thank you for that. And thanks again for being here tonight, Paul, and doing this with us. We do have a few more tour dates coming up that we'll be announcing soon. So stay tuned for that in case you're nearby and can come in person. I know, there was hundreds of people tonight, and I think we had 75 or more questions in the end. So we haven't got to everything, and there's lots we could talk about. There was questions about union busting and the drug poisoning crisis and that impact on other emergency rooms and so on, and cuts to public health and service closures and all these different pieces that we could talk about. And a question specific to EMS and Lethbridge, that I think we answered some of those in the chat, so people can look, or in the Q&A, so you can look for answers there. If you had a question that was very specific or you want more information, reach out to us at Friends of Medicare and we can get you an answer. But in terms of tonight, just to respect people's time and so everyone can get out and enjoy that sunshine, I just want to remind you that there are actions you can take, and we'll throw those links in the chat again. Right now, today, if you can send that email federally, you can send a provincial message, you can share your story with us, and we're collecting them, and we're going to use them in different ways or compile them in ways to get them out there, or encourage you to share them yourselves with the media, letters to the editor, with people you know. So talking about this wherever you can. And then, of course, please consider signing up to join us and to volunteer with us at Friends of Medicare. We have a large campaign right now pushing back against two-tier healthcare and to fix and rebuild the public healthcare system. So there are a lot of actions you can take. There are many events coming up you can join us at in person, in the real world, and help us out and share with others and so on. So please sign up, get involved, take those actions. Everyone doing it together makes a difference. And the fact that so many of you stayed on for this whole time tonight on this beautiful evening means a lot. And, stay tuned for when we share the videos and that, and you can share with people that maybe weren't here tonight and say, what you found valuable about it, and they can watch it as well. So, stay connected, sign up, get involved, and thank you so much for being with us this evening, taking time out of a beautiful spring evening to do this. And I'm sure we'll reach out to you soon in different ways to get involved. And one more time, thanks again to Dr. Paul Parks, who has joined us for 20 times, with more to come to share what's happening in public healthcare. So thank you, everyone, and have a great evening.
I'll make one last, I'll just comment too, for healthcare workers out there, especially frontline ones, usually face to face when we talk. I offer, so connect to Friends of Medicare. They have connections, and they can connect you to me personally too. So that's just one of the easy ways to do that too. But yeah, I appreciate this, and I appreciate everybody coming out, and hopefully go out and enjoy the start of spring here. So thanks, everyone.
That's my plan. Good night, everyone.